Tattoos and permanent makeup. The intradermal application of inks for the purpose of tattooing or permanent makeup, also known as micropigmentation. The pigments in these inks raise concerns about tattoo removal, adverse reactions to tattoo colors, and infections that result from tattooing. Many pigments used in tattoo inks are not approved for skin contact at all. Some are industrial-grade colors that are suitable for printer's ink or automobile paint. For some, tattoos are an aesthetic choice or an initiation rite. Some choose permanent makeup as a time saver or because they have physical difficulty applying regular, temporary makeup. For others, tattooing is an adjunct to reconstructive surgery, particularly of the face or breast, to simulate natural pigmentation. People who have lost their eyebrows due to alopecia, a form of hair loss, may choose to have eyebrows tattooed on, while people with vitiligo, a lack of pigmentation in areas of the skin, may try tattooing to help camouflage the condition. The primary complications that can result from tattooing include infection. Unsterile tattooing equipment and needles can transmit infectious diseases such as hepatitis. All tattooing equipment should be cleaned and sterilized before use. Even if the needles are sterilized or never have been used, it is important to understand that in some cases the equipment that holds the needles cannot be sterilized reliably due to its design. In addition, the person who receives a tattoo must be sure to care for the tattooed area properly during the first week or so after the pigments are injected. Removal problems. Despite advances in laser technology, removing a tattoo is a painstaking process, usually involving several treatments and considerable expense. Complete removal without scarring may be impossible. Allergic reactions. Although allergic reactions to tattoo pigments are rare, when they happen they may be particularly troublesome because the pigments can be hard to remove. Occasionally, people may develop an allergic reaction to tattoos they have had for years. Granulomas and keloids. Granulomas are nodules that may form around material that the body perceives as foreign, such as particles of tattoo pigment. If you are prone to developing keloids, scars that grow beyond normal boundaries, you are at risk of keloid formation from a tattoo. Although keloids may form any time you injure or traumatize your skin, keloids tend to occur more frequently as a consequence of tattoo removal. MRI complications. There have been reports of people with tattoos or permanent makeup who experienced swelling or burning in the affected areas when they underwent magnetic resonance imaging (MRI). This seems to occur only rarely and apparently without lasting effects. Tattoo pigments may also interfere with the quality of the image. This seems to occur mainly when a person with permanent eyeliner undergoes MRI of the eyes. Mascara may produce a similar effect. The difference is that mascara is easily removable. The most common problem that develops with tattoos is the desire to remove them. Removing tattoos and permanent makeup can be very difficult. Skill levels vary widely among people who perform tattooing. The main complication with eyelid tattooing is improperly placed pigment. You may want to ask the person performing the procedure for references and ask yourself how willing you are to risk permanently wearing someone else's mistake. Although tattoos may be satisfactory at first, they sometimes fade. Also, if the tattooist injects the pigments too deeply into the skin, the pigments may migrate beyond the original sites, resulting in a blurred appearance. Another cause of dissatisfaction is that the human body changes over time, and styles change with the season. The permanent makeup that may have looked flattering when first injected may later clash with changing skin tones and facial or body contours. People who plan to have facial cosmetic surgery are advised that the appearance of their permanent makeup may become distorted. The tattoo that seems stylish at first may become